I find that this is one of the turnkey events in my life lah.
袖状胃切除术就是去除掉50、60、70%的胃。It's the most difficult part.
Can you hear me?
手术过后，体重一定会降，降多少、降多久是靠病人的意志力。
Hi, nice to see you again.
It's like, who's this person?
One, two, three. Oh, okay. Higher, a bit more about 40.
这一天，英格医院的手术室里，医生和护士们正忙得团团转。
Can I have the cup pump and then the gel pen?
One more kilo.
Wait.
It's better.
Yeah, much better.
现年37岁的 Sidik 患有肥胖症，重达190公斤。医疗团队在为他动手术之前，必须进行一些特别准备。
OK, yeah, push up. 手术的时候，我就需要他的头偏高，他的体重就会压在他的脚上，所以我们需要保护他的脚。
Obese patients consume oxygen very fast, so we need to fill the lungs up with oxygen for a few minutes before we actually can put him under anesthesia. Just put that. If anything's going on, now this is just taking care of you, right?
躺在手术台上的 Sidik 原本还很轻松，但随着时间的推移，他的表情渐渐显得有些凝重。
Don't stress, OK?
Of course, the most extreme worry that I have is the failure of the operation and me dying. Like that's the most extreme lah.
Okay, we're just going to give you oxygen to breathe for a few minutes, okay? Just breathe in and out normally.
尽管此刻心情七上八下，但 Sidik 其实在这之前是非常期待这一天的到来的。为了登上这个手术台，他做出了许多努力。
I find that this is one of the turnkey events in my life lah.
Slow deep breath. Okay, think of something nice. Don't worry, Mr. Sidik. Do you want sweets, sayang?
Huh?
Oh wait, you cannot, right?
What are you talking about? You're trying to set me out.
No.
Food usually means happiness to me. So sometimes when I'm stressed, I will actually like binge eat.
Sidik 自小就爱吃，在资讯科技公司上班的他，10年前成立了家庭后，体重就一直有增无减，最高纪录曾飙升到204公斤。
The thing is, I have very good company, so me being very obese, there was no like negative impact on me.
不过1个月前发生的一件事，为他敲响了警钟。
So basically, I was chasing my son to reprimand him lah. I got so worked up that I had an asthma attack. It was one of the worst attack I ever had in my lifetime. It got me like really scared. Yeah, that is this gonna be like the day that I die?
向医生咨询后，经过再三考虑 ，Sidik 决定动一个减肥手术。
Listen, Mika and Mishari, listen. Okay, Ayah is going to go to the doctors. He's going to go to the hospital. Okay, you doakan for Ayah, can? Inshallah, the surgery will be good.
Take care of yourself, okay? I love you.
Sorry, Ayah.
I had this epiphany that I really want to see my kids grow up. So I decided to take the first step to initiate to lose weight.
Hi, good morning.
CIDIC 的主治医生陈俊海医生在几年里已经为超过500个肥胖症患者进行过减肥手术。对于肥胖这个普遍现象，许多人的理解仍然有所欠缺。
你看这个椅子就是没有那个旁边的 handle， 他们在外面都会有这样的问题，好像你坐下去就被那个手把夹住，所以他们就会有一点尴尬，有一点恐惧感来看医生。
一般人或许能够靠运动和节食来减重，但是对于像 CIDIC 这样的第3级别肥胖症患者来说，他们往往需要的是医疗帮助。
Hello, Mr. CIDIC, how are you? 等级3肥胖率的病人，他们要开始运动的时候，受伤的机会就比较高。他受伤过后，他又不能移动，他们的体重就越来越严重。OK, relax 啊。袖状胃切手术就是50、60、70%的胃会把它切除掉，过后留一个比较细的一个袖子，给你的食物能够进到小肠去。这是一个 OK？
胃部容量一旦缩小后，病患吃少量食物就会有饱足感。陈医生在替 CIDIC 开刀之前，必须先检查看他的胃部是否有什么异常。不过，这只是 CIDIC 必须进行的其中一项术前常规检查而已。
Okay, big breath in and out. You're doing okay. You're doing okay. Okay, Mr. CIDIC, all done. Well done.
手术前 ，CIDIC 还必须减重，以减低手术风险。这是为什么他必须提前2个星期入院。
1, 2, 3, 4, 5, 6, 7, 8. So you engage the core hand in front and try to kick backward. Go 1, 2, 3.
入院后 ，CIDIC 几乎每天都会参与一系列为他量身定做的运动。
10. You okay?
Okay.
5 more to go.
他在这之前其实是很久没有运动了，所以我们就选择他平常日常生活中会做的一些活动，像半蹲啊。其实他家里有一个2岁的女儿，那他可以用半蹲来蹲下去，然后再把女儿举起来。其实这是普通的亲子活动。
不到5分钟 ，CIDIC 就开始气喘吁吁了。
Should feel slightly breathless, but it should not be the extreme that you cannot talk. Yeah. Today you stay okay?
Okay, can.
虽然吃力，但 CIDIC 仍坚持把每一个运动项目完成。
Oh, enough. Okay, we can put the weights down, and maybe we will take about 1 minute break.
When you feel tired or lazy, just tell yourself you must have a good reason lah in the first place why you wanna go through this journey.
“体重将近200公斤的 CIDIC 为了逆转人生，在2个星期前便住院，为一项减重手术进行准备。
5, 6, 7, 8, 9.
一般接受这类手术的患者，其实无需进行那么多准备。不过，由于 CIDIC 的肥胖症特别严重，不减重的话，将会为手术带来风险。
Barista.
Right, it's like a martini.
Shaken not stirred.
Right.
为了减重 ，CIDIC 除了积极运动之外，也必须放弃他最爱的美食，改以极低热量饮食取代。
什么味道？这个水啊，没有味道的，是甜甜的
很像的。
很像哎。
CIDIC 坦诚，自开始节食后，有时看到美食仍然会禁不住诱惑，而想要破戒。但庆幸的是，身旁有人一直跟他同甘共苦。
So last start.
Yeah, let's start. Cheers. Let's go. Go. I feel like it's a bit not fair for him, you know, he has to go through this. I told him, like, okay, you know what, since you're going to go through this, I'll go through it with you. Come, we take the PLCD together.
其实，自从 Siddiq 踏上减重之路以来，不管是运动还是节食，妻子 Zainan 都会陪同他一起完成。
I want him to know that basically I married you for a reason that, you know, I'm in this whole life with you. I want you to know that I'm there for you also. Sakit.
My wife have been very supportive throughout my journey. Last time, to be honest, I'm a couch potato. Last time when my wife go to the market, I ask her, you can go by yourself. But now it's more to like, I want to get my body moving, you know. So I spend more time with my wife and my kid.
As much as I try to put a strong front also, but I'm very scared if he was to go on without me.
I see you.
Okay, he's asleep.
OK, starting. 来。
在切除胃之前，外科团队必须先掀开肝脏。一些肥胖病患在进行这项手术时，所面临的其中一个风险就在于这个步骤。
当时他是204公斤，他的肝应该是会有脂肪肝的现象，然后要把肝移上才能够看到你的胃，危险性就是流血的现象。OK， 哇 ，nice。
Siddiq 过去2个星期的努力，看来没有白费。
今天的手术算是说很顺利，他的肝受的比较能够没有问题的把它移开。
袖状胃切除术的目的就是将病患大部分的胃切除，只保留一小部分。为此，在开刀之前，外科团队会将一个叫做胃校准管的管子置入食道，一直到胃里。手术当中，外科医生陈俊海医生要衡量切除的部位时，就得靠这个管子。而操控这个管子的人，其实是手术室里另一位重要的人物。
Most of the patient knows the name of the surgeon, but not the anesthetist. But it's okay. It's still a very hugely rewarding job for me, especially when I think of the end of the day, we actually can send the patient home back safely to their loved ones.
麻醉科医生的主要职责是确保病人在手术中的安全。除了帮助病人在无痛、无知觉的情况下进行手术，麻醉科医生也必须在手术中时时刻刻监测他们的生命体征。
Every patient is different. You can't AI the anesthetist. We are always ever ready in any emergency situation to work through the crisis.
Stapler. Reload.
短短1个小时内 ，Siddiq 的胃已经开始被分成2段。
Maybe 2 more.
袖状胃切除术其实是一种减重代谢手术。这类手术主要通过改造病患的消化系统，帮助患者长期减肥。
减重代谢手术不单单只是限量你的食物，你的荷尔蒙、你的代谢率也是会有调整。
手术后，荷尔蒙的改变会让病患的食欲减少，代谢率的改变也会让体重更容易逐步下降。不过，这并不代表病患的肥胖症就治愈了。
Go. Specimen. Clean stitch.
虽然说这个手术能够帮助病患在节食和运动后更容易减重，然而如果病人过后还是暴饮暴食的话，最终还是有可能复胖的。
我通常都是跟病人讲，这个旅程算是10000步，我帮你踏出的第一步就是帮你做这个手术。手术过后体重一定会降，降多少，降多久，那也是靠病人的意志力。
CD? Operations over, CD. Can you hear me? CD, I want you to take a deep breath. Breathe in and a big breath. Open your eyes.
Sore, is it? Okay. That's quite expected. We'll give you some painkillers if you need.
今早接受了减重手术的 Siddiq 清醒后，发现自己躺在高度依赖病房里。
A high dependency unit is a step-down care from ICU or a step-up care from the general wards. It's an area for close monitoring of patients whose conditions are already quite serious or are at risk for deteriorating at any point in time.
I'm gonna give you a bell. If you need anything, you press this, okay? And you give us a call.
由于 Siddiq 患有阻塞性睡眠呼吸暂停综合征，手术后可能会出现呼吸困难，因此需要小心观察。在高度依赖病房里，病人的心率、血压、氧气饱满度会传输至一个中央监护站，一旦出现偏差，就会引发警铃响。手术完成后 ，Siddiq 其实身体状态良好，恶心呕吐是术后常见的并发症，护士们都能临危不乱地面对。
When someone is admitted to the ICU or HDU, it's usually the most terrifying yet helpless time of their life. So be it when we are encouraging someone who is lying helplessly in bed, or when a loved one's condition turns for the worst, we have to be empathetic.
Mr. Siddiq, how are you?
这时 ，Siddiq 已经开始渐渐恢复精神。
So by sitting up, you actually will feel better. This chair also better, right?
陈医生早前已吩咐医疗团队把适合 Siddiq 坐的椅子搬到病房里。
I'm really appreciative of how their commitment is lah.
Operation, I would say, as smooth as we can get lah. No surprises lah. So good job.
Thank you, Dr.
Welcome.
Before going for this bariatric surgery, right, I thought that I just have this surgeon and I just operate. But there are a lot of other people who are going through this journey with me. I want to give my best because I know they are giving their best.
"自从接受手术以来 ，Siddiq 瘦了约14公斤。
Hi, nice to see you again.
I feel I'm actually losing weight at a very comfortable pace. A lot of people lose weight like they try to motivate themselves, but people lose motivation. But if you yourself is self-disciplined, then you tend to do things every day.
Siddiq 从外表上看来，虽然未出现巨大变化，不过生活上却有了重大的改变。
So as you can see, right, if you were to put like sesame oil, 1 teaspoon 5 ml, right, is already 41 calories.
He is a calorie counter now. Seriously, my husband, he used to not care about all these calorie counting and everything. But like really directly after the surgery itself, he's like, oh, I need to research. He's like, who's this person?
Ready?
减重是一场艰难和漫长的战役 ，Siddiq 要达到健康的体重还有一段遥远的距离。不过，他已经开始慢慢体会到，拥有一个健康的身体，能为生活带来各种小确幸。
Last time, I would just sit at the side, just look at them play. But then now, I can help them climb the playground. Yeah. Sometimes I give them short teasers.
Now I can catch me.
我们的工作不单单只是开刀、动手术，有些病人在1年、2年过后怀孕，就能够有家庭。有一个病人就很怕离开家里，因为怕其他的人取笑。手术过后，他能够自己出去坐地铁，那能够改进他们的生活的话，我们做医生的也是会有很多的满足感。
遇到超重的病人，手术团队会使用一种特别床垫，经充气后，床垫会稍微悬浮，并且将病人的身体托起，这样医护人员就能将病人转移到手术台或病床上。